Welcome back to the Recovery Channel. I'm Brian Ariel, Treatment Director of the Outpatient Recovery Program at Applied Care Services. This time, we're going to talk about avoidant behaviors and kind of patterns of avoiding and avoiding specific things or even just avoiding in general. Recently, I've had a couple clients that it seems like they have this pattern of avoidant behaviors. And it got me thinking about how avoidant behaviors in our recovery, not only from addiction, but from mental health, can lead us into being stuck or just, we're not doing anything. We avoid the issue. We avoid everything. Avoidance refers to specific behaviors that we might, or situations that we find ourselves in, that we want to get out of, right? So we avoid them at all costs. We might make up excuses like going to a family event and at the last minute we cancel. Or maybe we dip out on a job interview because we feel like it's not going to go well. We might have increased anxiety, or we may be feeling depressed, or we might have other things going on. And we just want to avoid the situation altogether. So we engage in some of these avoiding behaviors. Like I already mentioned 2 of them, right? Where we just say we cancel at the last minute or we just don't show up. And we're avoiding. We're avoiding the potential of a conflict or something that we don't want to face or deal with. So we avoid. There's other avoidant behaviors, such as like addiction. Substance use is an avoidant behavior. We're avoiding dealing with what's going on either around us, either physical pain, emotional pain, mental pain, all those things. We're avoiding something when we're getting drunk or high. We do the same thing in our mental health. Maybe we are low motivated because we're in severe depression. Or maybe we have super high anxiety because maybe we've placed unrealistic expectations on ourselves. Or we have a fear of something that might possibly happen, but it's not a guarantee. So we choose to avoid. What happens when we avoid? Sometimes we feel real left out. We feel more depressed, more anxious. Because now, oh my goodness, the person's going to ask me, like, why didn't you show up? And I'm going to have to think of an answer, and oh my goodness, right? Or when we're depressed, we might feel regret and shame. Like, I should have went. I woulda, shoulda, coulda, right? And we always say you shouldn't shoulda on yourself. But avoidant behaviors can be overcome. And some ways that we can overcome avoidant behaviors is by choosing like opposite action. I don't really want to do this, but you know what? I'm going to do it anyways because I know it'll be better for me. Journaling can be another way of dealing with avoidant behaviors and also like the emotions around them. Seeking a therapist might be another way. Or even medication management might help too, because maybe we're not coping really well with our symptoms, either through skills or medication, and so maybe, talking to your doctor or prescriber about, is there something that can reduce my anxiety or lift my mood, and those things. When it all comes down to it, there's certain things that we can avoid, and there's other things that we should not avoid. If it's unsafe, like we know it's unsafe, then I would say avoidant behaviors can be a positive thing, right? We're avoiding the risk. We're avoiding damage to ourselves or damage to others. But when we self-impose and we isolate ourselves away from support, we isolate ourselves away from interaction. If anything's taught us anything over the last 2 years, is that human interaction is very important. And human interaction can lead us to insights to feel better about ourselves, to challenge those negative thoughts that we might have, and to confirm in our own mind that we were just maybe, possibly, just blowing it out of proportion. So either way, we need to learn how to challenge our avoidant behaviors. If there's something you don't want to do, choose opposite action. Do it anyways. Push through it if you can. If you can't, then maybe you need to think about the impact that these behaviors are having on your life. Are you happy where you're at? Are you happy with what's going on? If the answer to those is yes, then you don't have to worry, right? But if the answer to those is no, I'm not happy with the way things are going, I'm not happy with my life, then maybe it's time to ask for help. And not asking for help is also an avoidant behavior, because we might fear judgment or whatever. So that's a little bit about avoidant behaviors. I hope this helped you, and I hope that you can find what you need to help overcome your avoidant behaviors. And as always, if there's any services that you're looking for and you just happen to be in Minnesota in the metro area, Applied Care Services is here for you. We do in-home and in-office outpatient mental health therapy. We do ARMS, and we do substance use treatment. And until next time, have a good one.